So there's always this going to be this perpetual discussion about are masks are mandated within my area. You should be wearing a mask. You had that lady in Ohio who was tasered for not wearing a mask because it was the law, and it wasn't even the law. It's a mandate, which is not the law, right? You can't be arrested for breaking a mandate. A mandate is more like a plea from a local official. It has to go through state legislature and be passed for it to be, of course, a law. And of course, Dr. Fauci was, of course, quoted, who is, I guess, one of the bigger people in the business in relation to the so-called virus. And so back in June, Dr. Fauci, of course, is quoted. He says, Americans who don't wear masks may propagate the further spread of infection. He so goes on to say, says the White House health advisor said he has no doubt that Americans who are wearing face masks, especially in large crowds, or not, it says, are increasing the risk of spreading the virus. He says, when you have crowds of people together and you have a lack of wearing a mask, says that increases the risk of there being transmissibility. I have no doubt about that. Right? Fauci, director of the National Institute of Allergy and Infectious Disease, also said Friday that the outbreak in the U.S. appears to be going in the right direction despite a few blips. Right? So this is someone who he's served a very long time in this capacity. Right? He served as an infectious disease doctor for decades. This isn't someone who is new to his field. He is someone well known in his field. And literally just a few weeks prior to, of course, this interview that he did, of course, with the mainstream media, he is, of course, in another interview back in May, saying,
now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask.
Right. So you see the man says, you're sure, right? Because people are listening. People are listening on whether or not they should be wearing a mask at this time, right? This is already during the pandemic. And this is what he says.
When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And
that's really the point, right? This is the unfiltered version of Dr. Fauci, right? Who is an infectious disease doctor who has worked in this capacity for decades. And as he said, it makes you feel better. And this is exactly what many lawmakers, many governors, and many politicians, they build on. They build on, it makes you feel safe, right? Because they inspire fear that I'm going to get the virus. If I don't have a mask on, I'm going to get the virus, right? You've seen people even attacking individuals that don't have a mask. We've even seen, like I've showed before, people being arrested, right? You're trespassing. This is the law. You're not wearing a mask. You're going to spread the disease. Of course, this is the unfiltered version of Dr. Fauci stating the facts about whether or not the utilization of the masks that many of you people wear out in the street on your everyday, when you go to the supermarket, etc. As he said, it might drop. It might prevent a blip of infection from spreading.
Often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
And this is true.
And can you get some schmutz sort of staying inside there?
Of course. But when you think masks, you should think of healthcare providers needing them,
like me,
and people who are ill.
Right? Healthcare providers like me. This is exactly who typically utilize these masks. Many of these masks, threw mine away. Actually, here it is. Right? Many of these masks are designed to be used for very short periods of time, right? So especially because as you're wearing this mask and you're breathing through the mask becomes wet, right? Because you're breathing out moist air, the mask starts to become wet, right? If you start feeling your face starts to sweat, the effectiveness of the mask begins to dwindle, because as these masks become wet, they become less effective at preventing infection. That's why in the field we use these sparingly. We use them for when we walk in, and then we toss them away. We don't hold on to them like many of you who may be wearing these masks for long periods of hours. Many of these masks are not designed to be worn for more than a couple of hours, and that's if the mask is not wet. If that mask is wet, it should be discarded immediately, because its effectiveness, of course, dwindles by utilizing it. Of course, as you're using these type of masks, of course, they're filtering, right? They're filtering particles, and of course, as they get worn, like any filter, they need to be changed. And I see many individuals, I see a lot of people in my neighborhood wearing these old, dirty masks, like they've been wearing them since the beginning of the outbreak. I saw this old man as I was waiting for the bus to go to work, and I see this old man with a surgical mask on, and it looked like he had that thing literally for months, and it was stained and discolored. You could even on the strings around the ear, it was dirty. And I've come across even bus drivers, right? But this is information that they typically don't give out to individuals. And literally, this is the unfiltered version of Dr. Fauci stating plainly the facts. And it's true. When I'm wearing a mask at work, especially because at the hospital they require us to wear these masks, right? These surgical masks for the duration of the shift. Whether or not your patient has a respiratory disease or not, we are required to wear these masks for the duration of the shift. Previously, it was only if you didn't get the influenza vaccine. If you chose not to get the flu shot, then during that time you had to wear a mask until the CDC said that we're no longer in the window where people are more likely to contract the flu virus. And of course, that has changed. Now we are wearing these masks for the entire duration of the shift. Many people are utilizing these masks or utilizing N95 masks, and they wear them the whole shift, and they're not designed to be worn for the entire shift. You can easily look this up on the website of the people who manufacture them. An N95 mask can only be utilized for up to 8 hours. Most people I see, especially in the hospital setting, are utilizing these masks for 12-hour shifts. Many individuals don't even change their masks. You're supposed to change your mask from patient to patient. Many of these individuals wear literally the same mask from patient to patient to patient. Even though that we never learned to do things that way because of infection control. And I see this all the time, and I see it every single day. You see the doctors come in, they walk around with the same shield, they walk around with the N95, and they put a surgical mask over it, and they go from patient to patient to patient to patient. And this is never the way that we learned to prevent disease. The reason that I see this more and more is because people are afraid, despite the facts, right? Despite the facts of how viruses are transmitted, even medical professionals are so afraid of contracting the virus that they're acting not in conjunction with their medical training. I see doctors and nurses wearing N95s out in the community with gloves. And I look at them, and they know when I look at them that I'm looking at them like, why are you wearing that? I know that you're not doing what's right. You're just afraid. That's why you're wearing all that stuff on the outside. Chances of transmitting the virus is so low, especially because it's not that deadly. Yes, many individuals have lost their lives. The CDC stated it was roughly around 9,600 individuals that lost their lives solely to COVID. The CDC tried to retract and say that, well, yeah, but it doesn't mean that the virus is not that deadly. And then they compared it to, for example, someone committing suicide who also has comorbidities, and saying, well, yeah, while the person may have comorbidities, what really took their life was suicide. And that is a poor example to compare the current virus. The reason being is because if you commit suicide, whether you do that, with a gun, or you hang yourself, or you take medications, for example, We've had people recently that have come in for opioid overdose or Tylenol overdose or maybe some other sort of medication that they've taken in an attempt to take their lives. The reality is that suicide is much more abrupt at taking an individual's life and is much easier to discern that that individual died as a relation to this particular event, namely suicide. And of course, that is not the case when it comes to the current pandemic. There have been very few. It doesn't mean that because they're in the hospital and have COVID, that they're in the hospital for COVID, right? There's a patient that we have on the unit just last night who was an end-of-life patient who just now tested positive for COVID. That patient was going to die regardless. Now that patient, of course, tested positive for COVID, and so he will be counted as a COVID death. I've had patients that have come into the hospital and tested positive, but they weren't there for COVID. But those individuals, of course, are lumped up into the numbers. And this, of course, is the most inappropriate way to gauge the deadliness of this particular virus. It's almost irrelevant to talk about testing and individuals who test positive when you have had problems with the tests, right? If you have people who test false positive and false negative, the only thing, of course, that really matters is how many individuals are solely dying just from that particular cause, right? It's like we learned in old school chemistry. Maybe you probably took chemistry in your first couple of years of college. And what did they teach you? If you want to see for your experiment which is really causing the reaction, what you have to do is you have to start removing things one by one, or you start adding things one by one to see what's effectively causing the reaction in the chemistry experiment that you were performing. And that's the exact same thing when it comes to viruses. Was it the CHF that killed that person? Was it the pneumonia that they had that killed that person? Was it maybe the patient got too much fluid and they had a weak heart, and now you've caused that patient to have fluid overload, and then that patient developed pneumonia, and then you tried to be pushing Lasix all the time, and then you injured the patient's kidneys as a result of the choices that are made when trying to manage patients. A lot of this information, of course, is not given to people in the public. And of course, the least amount of information is given to you so that it pushes you into a particular direction, right? This is just basically my spiel for today on talking about this, because people even at the job and in the community, they ask, "Oh, where's your mask? You don't wear a mask? Where's your mask?" And even according to Dr. Fauci, as he said, you don't need to be wearing a mask.